So now we have these drugs, these immunotherapies. How long should these patients stay on therapy?
You want me to go ahead? That's the immunotherapy question. I think that is one of the biggest. I don't want to say unmet need, but it's a big need in trying to find out how can we improve the value of these drugs. You know, all the trials were written when these drugs were approved that patients just stayed on them for some of them indefinitely, a year, 2 years. I've personally had several patients that said, you know, I've been in a complete remission for a year. I'm ready to stop, and we've done it, and everything's been fine. I know there's stories of patients that do have late relapses, but I think it would be nice moving forward to have some randomized studies of saying, hey, we're going to try 4 months, 8 months, 12 months, and see what we can happen. And I think the risk is relatively low. Although but that we could probably salvage these patients if, in fact, they do recur. Do
patients that respond to an immunotherapy and then stop, do they respond again, Dr. Kaufman?
They can. We certainly have data that ipilimumab can be used for reinduction, and some patients have responded. It doesn't always happen. I've also seen a small number of patients with IL-2 who've had a partial response, and at the time of progression we retreat them, and there's a very small number of those patients that may go on and respond again, but I don't think that's the rule. And I think with PD-1, I think it's a little bit too early to know what's really going to happen with those drugs. I certainly would probably feel more comfortable right now going to something else than somebody who is relapsing after PD-1 treatment.
I see. Dr. Pavlik, you agree?
Yeah, I do. But I strongly feel like you do when it comes to a patient who has a complete response. How much is enough? When do you stop? I also think that maybe too much stimulation of the immune system is maybe not a good thing. Mm-hmm. Do we turn off different parts of the immune system by the constant bombarding of the immune system? So I think we need to do this again in a very well-controlled manner with a clinical trial, asking that question of when you get patients to a complete response, how long do you just stop? Do you give them an extra 6 months? Do you give them an extra year? But I think there has to be a stopping point.
Right. So some of this was built into the clinical trials but not presented yet, and I look forward to some of that being presented. I know that the PD-1 trials would allow you, if you had a constant complete response, to come off and watch. And anecdotally, we've seen, and it's been published by the Yale group, responses to PD-1, but when and how long still needs to be ferreted out. But you brought up a good